So welcome everybody. We are now at Sharjah Next, and our speaker is Dr. Mohammad Al Omari. He works for Roche Diagnostics Middle East, and he's a head of Diagnostics UAE, Roche Diagnostics Middle East. So, Dr. Mohammed, welcome.
Thank you. Thank you
Nice
for
to have
having
you
me
here.
today.
So, Dr. Mohammed, before starting, could you tell us about yourself and what you do exactly at Roche Diagnostics?
First of all, thanks for having me, Dr. Khalid, and it's a pleasure to be in Sharjah Next. My role in Roche Diagnostics UAE is around acting as a catalyst, ensuring that our digital innovative solutions, um, diagnostic solutions, are accessible equally to all patients. So that's one of the dimensions.
Mhm.
The second dimension goes beyond the solutions, which is collaborating with healthcare authorities, our business partners, to co-shape the ecosystem and elevate the development in the ecosystem in the UAE.
Right.
In Roche, we have a simple but also a profound purpose, doing now what patients need next. And that somehow explains that we always have to do what we have to do as of today, but we also has an eye on the future
Right.
and how can we make sure that we have this proactive step.
Right.
This cannot happen without the collaboration. Today we heard about, one of the biggest challenges is basically how we connect the different pieces of the ecosystem.
True.
So collaborating with authorities, regulators, clinicians, and policymakers are essential to make this formula work.
Right. And when we say Roche Diagnostics, do we mean only diagnostics or you're involving as well in treatment?
So Roche has a unique position today.
Right.
Roche has Roche Pharma and Roche Diagnostics, and both have a rich pipeline of innovations. So we work closely. We actually share the same office, and we work closely on multiple models that includes personalized healthcare and precision medicine.
Right. That drives me to the next question, actually. So, whenever you're a doctor, the most important part of being a doctor is that knowing the disease, diagnosing the disease before even starting any sort of treatment. So, in your perspective, how is the field of diagnostic evolving? And could you tell me something really exciting in terms of innovation?
Yeah, of course. I mean, if we zoom out a bit and look how diagnostics have evolved after COVID, I think diagnostics is going through the golden era,
Mhm.
and that has been seen with WHO in May 2023. They released a resolution to invest more in diagnostics. Based on WHO, also studies shows that most of 70% of decisions today in healthcare depends on diagnostics. Yet 3 to 5% only is reserved as a budget for such a sector.
Wow.
So that has a kind of eye opener that how much we need to invest in diagnostics. And that evolved in multiple dimensions: investment in digital health, investment in early diagnosis and prevention,
Right.
and of course we see so many trends that are going in parallel. Today, labs are going through centralization with their gaining efficiency, but we see in parallel as well the decentralization model is also accelerating for faster decision making.
Right.
The most innovation that excites me the most is, of course, our newly launched continuous glucose monitoring,
Mhm.
IQCheck Smart Guy. And why it excites me, basically, because two elements. One, it addresses a high burden disease, diabetes.
It does, yes.
And the second point is it has an AI functionality, which is predicting, the future of a diabetic patient.
Right. The chance of having diabetes in the future.
Hypoglycemia, yeah.
So, is it different from the one we use all the time, the blood test HbA1c?
Yes, yes. This is a continuous 24-hour
Right.
monitoring, and it gives a real-time measurements. But the edge of our solution that it gives a 2-hour prediction where patients need to then basically um, take care of themselves before, for example, they go to bed.
Mhm.
So they can predict based on my diet today how I will look like in 2 hours in advance.
Right. You just mentioned now regarding AIs, and whenever we go now, everybody speaks about AI. Everybody speak about precision diagnostics. People speak about personalized healthcare, so everybody has his own thing. It's not one recept for everybody. But those kind of, we call them like a buzzwords in healthcare, right? And could you elaborate on these terms and provide a real life example to our audience to understand them?
Yeah. Yeah, of course. I mean, it's everywhere. And I would say AI, digital health is kind of a big umbrella that covers most of our current technologies that we see today. And maybe I start with that all these terms are somehow connected. So if we talk about precision medicine, it's basically using genetics, molecular data in combination with AI analytics to personalize the treatment. I mean, we are as individuals have unique genetic materials. And that I think the beauty of science, where we realize that each one of us respond differently
Mm-hmm.
to a certain path of treatment. I mean, given that edge, I would say precision medicine is becoming more and more important in some areas like oncology. Now it's kind of becoming as a routine to make sure that people gets the right treatment
Right.
at the right time. That is one of the, again, what I said before is basically the unique position of Roche, having Roche Pharma and Roche Diagnostics work closely in real use cases where we address certain disease areas like lung cancer, breast cancer, which also are high burden diseases, on make sure that this concept is applied.
As if we're talking about something like somebody has an infection and there is one type of antibiotic to everybody. No, in fact, this person might not respond to that part of antibiotic. Same thing goes with oncology, cancers, and other stuff. That's why I think personalized treatment is very important.
Yeah.
And you're doing great job, like looking up to the genetics level. So exactly, you know, what could help this patient.
Exactly, and the digital is actually helping a lot to accelerate such an approach in the healthcare.
So you just attended Sharjah Next healthcare event, and from your experience, what are your impressions of the innovation and investment climate in Sharjah?
I mean, now we just left the opening,
Yeah.
which was very, I mean, it was impressive to see that the vision aligns very well with what we have as multinationals in general. I mean, today we saw a prototype of a future state-of-art hospital.
Mhm.
We saw today so many projects that will really disrupt the future of healthcare. And I think what I like the most is the atmosphere that we have in Sharjah, which is an openness to experiment,
Right.
um, and the seamless collaboration, that accessibility,
Right.
sharing vision and clarity.
Right.
So all this, I think, it's a foundation and the ground
Right.
for all the companies that are basically they want to start something, and this is where we feel like the ground to plant
Right. It's their
such
platform.
ideas.
It's
Exactly.
their platform. So you can innovate, you can think about anything, and you can come here and you might apply it, and it could happen, it could help. Exactly. So now, there is always a discussion with the policymakers and maybe even with the health care professionals. So, what is or what are the messages that you want to deliver about the importance of investing in diagnostics and lab infrastructure?
I mean, maybe in one statement, diagnostics and healthcare is not a cost.
Right,
It's an investment, as you
right.
said.
Mm,
And if we realign ourselves around the vision in the UAE,
mm.
happier communities require
Healthy community.
healthy people.
Right,
And healthy people needs a robust system
right,
that not only serves the needs of today,
right,
but without compromising the new generation's
right,
needs. And this is what we work closely. And again, I want to reemphasize on the importance of collaboration between the different party of the healthcare ecosystem to make sure that the value chain towards the patient are emphasized and more valued in terms of
right.
outcome.
Mm. So you just mentioned like it's on they invested only 3 to 5% on diagnostics, right? True. And imagine like only 3 to 5% diagnostics not only help us to treat a patients, it helps us a lot, especially screening the patient before having the disease. And you can only do that by having a better, more equipped diagnostics.
Yeah, and that could be basically you're having an early diagnosis like
Right.
national screening programs, and that's one of the key projects that we collaborate with. technology when it comes that you are near more the patients, you're closer to patients in terms of, and we see today the home testing, the wearables, the seamless connectivity with the clinicians and the healthcare providers, that all will play a role in terms of reaching closer to patients. But also the sensitivity of the technology matters. And I'm also very excited that this year in Roche has been a really exciting year. We launched the mass spectrometry, the first fully automated mass spectrometry where sensitivity really there matters. And that's also one of the factors that contributes to an early detection.
Mm-hmm. So let's say 10 years from now, what is the really exciting thing for you in regards to diagnostics?
So many ideas, I would say. First of all, I see patients taking more ownership of their health.
In terms of treating themselves?
I mean, they will be more aware on how to take over and proactively manage their health.
Right.
And that will come with a set of tools that will open the ecosystem in a way that patients will have more accessibility to healthcare. The second one, the education level of the patients will definitely elevate.
Mm-hmm.
And the last one is how can we leverage on the tremendous amount of data that today is generated by all these devices and digital solutions and translate them into decisions. And that is one piece. The second piece, I see that the ecosystem in healthcare will also enable more technologies,
Mm-hmm.
and that is mainly for the regulatory landscape to adopt more digital and AI. And we will also, of course, need to work more towards some of the diseases that we saw today, like the neurology diseases, and one of them is the Alzheimer, which kind of everyone is talking about now. It's increasing drastically, and the more we address those diseases, I think the healthier communities we will have.
So I think screening is one of the most important aspects of medicine, I would say, and you can only screen by knowing when to diagnose and using like new tools, especially with the digital health and AI is going to make a big difference. Um, So wherever you go, definitely there are some sort of challenges in any healthcare. Like, why don't we speak about the healthcare challenges here in UAE and the region? How can diagnostic help address them?
Yeah, I think diagnostics is standing in a position where we connect the patients with the clinicians and the treatment.
Right.
And that's what I said about really connecting the different parties of the ecosystem.
Mhm.
I think that's the biggest challenge. And it was said today by one of the esteemed speakers today. So how do we find the common ground where we set with reimbursement, policymakers, authorities, regulatory, and agree on our priorities? And that's maybe what I said about connecting the ecosystem.
Right.
That will help us to basically move forward with some of the interesting opportunities that we have forwards. One of them is, of course, the increasing adoption of digital. And the second one, of course, is how can we launch more and more screening programs that will help contain and early detection and even prevention of some disease areas. So we have so many opportunities, but how can we really realign our common goal towards those opportunities?
Like ideas all over the place. Just like you mentioned, we need to sit down, collaborate, and come up with a plan that will help everybody in diagnosing and even screening disease beforehand. So I understand that Roche recently collaborated with Spark and the University of Sharjah on the Migraine Lab Certification Initiative. Can you tell us more about that?
Yeah, that was one of the interesting meetings where we started to talk about that healthcare is supposed to give back to communities, and we don't want to take. So
What do you mean by that?
I'll give you an example. Based on some studies, shows that labs consume 5 times water versus office places. It consumes way more energy
Right.
and heat emission versus office places. So there are some studies around how labs are operating when it comes to the environmental sustainability. And sustainability has 3 main pillars: social sustainability, which is how you basically take a proactive step towards the patients.
Mhm.
The second one is economical sustainability, which is, I think, self-explanatory when it comes to efficiency.
Right.
And the last one is the environmental sustainability. And it was like kind of spark when we aligned with Spark on that this common goal. Like, we want to raise awareness. We want to make sure that we elevate the bar when it comes to the environmental impact that labs can generate in our ecosystem. So we started with a use case in University of Sharjah, addressing, and that's this certificate addresses 14 points on the operation. That includes green chemistry, that includes waste management, it includes as well digital using, and many more. So we started to implement the first Green Lab certificate in Sharjah, and we would like to create a kind of showcase where we inspire other organizations, other hospitals to do the same.
And when we say green, you mean like more sustainable in terms of like it values the ecosystem here?
Yes, it basically, you need to reach to a point where net zero, we call. So whatever you contribute to the community, you need also to make sure that this is balanced with good practices in the operation in the lab.
Right.
And overall, there are multiple tiers to such a certificate. The highest one is green.
Right.
So we're aiming towards that one, and I am sure that I'm excited to really create a good use case that can be inspiring in the UAE.
You just mentioned something really interesting for me, to be honest. And when we say lab, they consume a lot of water. So what's going to be the difference if we applied the green lab?
There are, I mean, there always comes with the options.
Right.
And I may maybe emphasize on an example of green chemistry today. There are some, I would say, some items that the procurement might buy that could be cost efficient, but not very environmental friendly when it comes to the how it's structured as an item. While there are some choices that are more green and more environmental and less environmental impacting for the lab. And this is, again, when it comes to the water, there are choices today on how the systems are using the water, how the operation, plastics, paper, and there are so many consumables in the lab that if you look at it, it's huge.
Yeah.
And another interesting statistic, a lab consumes 9 big trees per year.
Wow.
On paper wise. So, and that's again, there are many studies that shows the impact there. But those are really strong statements that make us reflect. I mean, how can we change that?
I think that's very interesting, actually, especially when you mention the 3 pillars that we're going to speak, that you guys will try to implement as much as possible. Anyway, Dr. Muhammad, really happy to have you here. And inshallah, we'll see you next time. Thank you very much for such a beautiful talk. And inshallah, we'll see you soon.
Thank you very much.